Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for taking time out of your day to join me and hear what's going on with COVID in Ulster County. At the high level, I'll give you the snapshot, and then we'll dive into the numbers and where we're at. We are seeing, unfortunately, active cases in the county start to climb back up, over 2,300 active cases right now. Most concerning, we are seeing an alarming increase in hospitalizations. Since our last update Thursday, we're up 9 additional hospitalizations. And I think on top of mind for everyone is that the vaccine rollout continues to be frustratingly slow, and we'll talk about that as well here in a minute. All of those things have combined, I know, to create a very high degree of concern and anxiety and frustration, and we're hearing that, I'm hearing that, and feeling that. And I think as we are now just a few weeks into 2021, I ask us all to remember, we knew coming into this winter that it was going to be a long winter, a difficult winter, a challenging winter, but that there is another end to this and that we are slowly making our way towards it. And so before we dive into the numbers, I just want to remind us all that, and urge us all to continue to channel that sense of we are going to get through this together. And together is the operative word. We have to continue to be patient, to be understanding, to try our best to absorb these challenges and these trials being thrown at us and really stick together and stay resilient through it. I know it's extremely difficult, but I am confident we can do that if we all just remind ourselves of that. So those are my opening thoughts here for this week. Diving into the numbers, right now we are at a cumulative case count in the county of 8,375 since March of 2019. It's almost a year, getting close to a year into this pandemic in the county. We've now tested 225,630 residents and continuing to up our testing capacity and push as much as we can there. Fortunately, we've had 5,846 recover. Unfortunately, we've now had 177 of our residents succumb to COVID, 177 fatalities, and that's 7 additional fatalities just in the last 5 days since our last update. So unfortunately, so far through December and January, we are above a pace of averaging more than 1 fatality a day in the county, which is just absolutely heartbreaking. And unless we can get this second wave back blunted, I fear that we will continue to see that. And as always, our thoughts, my thoughts, and love and condolences to all those that have lost a loved one or have someone in the hospital or very sick right now. We're thinking of you, and in the spirit of remembering what's happening and sticking together through this. When you're frustrated about a mask or a restriction or maybe not being able to get a vaccination as fast as you want, please think about those that are in the hospital right now, very, very sick, or those that have lost a loved one or those that have lost their life, and keep that in perspective. In terms of hospitalization numbers, as I said, this is a point of great concern right now. We are currently at 37 hospitalized in the county, 5 ICU. That is up by 9. We were at 28 in my last update on Thursday, and fast forward 5 days, and we're up to 37. You can see in the graph that there has been a bit of a kind of ebb and flow, but that the overall trajectory has been increasing. We still believe that particularly on hospitalizations, we are not seeing the holiday effects yet. And so it is possible that some of this increase is the beginning of the holiday gathering effects of those that got very, very sick now needing to be hospitalized. The other item we continue to look at, of course, is the active case number. You can see on the graph here, and I talked about this last week, we were starting to tick down right around the beginning of the new year, but now are back up again to 2,352 active cases. Hopefully that will not continue to climb due to holiday surge, but I do think it's possible we could surpass 2,500 active cases and hopefully not continue to go up. Once again, that is in our hands. We'll talk about that in a minute, but we are watching the active case count closely as well. The new positive rate is definitely lower than it was at the worst. At the worst, we were right around 9, 10, 11%. Right now in Ulster County in the last 96 hours, we're at a 6.76% new infection rate in the county over a 4-day average. That number comes from having tested 6,495, so we've tested 6,495 and had 439 new positive out of that tested. Once again, a 4-day average of 6.76%. In the last 24 hours, we've had an 8.1% new infection rate. As long as those numbers are well above 5 or even 3 or 4% new infection rate, that's a level at which unless we can get that new infection rate down, we will probably stay at an active case count around or well above 2,000, and that then flows, of course, to more getting sick and unfortunately more passing away. Looking at the long-term projections, this has essentially stayed the same. You can see best, middle, and worst case here. We are slightly, possibly starting to see the best case forecast bend down a little bit and not be quite as steep, but that's very much in our hands in terms of what we all do collectively in the next days and weeks. Finally, hospital capacity. I talked about the current numbers and the increase, 37 right now, 5 in the ICU. We are a little bit tighter than we'd like to be on ICU beds, so we did sort of downgrade the capacity threshold there and set at risk of exceeding capacity on ICU beds. That is something that, working with our hospital partners, if needed, we can ramp that up. So we're watching that, and if needed, we will be able to bring that number up. And we do have sufficient capacity on regular hospital beds looking out into the future. So while we wait and continue to push for a faster vaccine rollout, which I'll talk about here in a moment, the most effective tool that we all have collectively as a community and as families and as colleagues to control this and slow the spread is still very much the same set of guidelines and precautions that we've been using to mostly to effect for the last year or almost year. That is mask wearing, hand washing and hand sanitizer, social distancing, and avoiding those social gatherings, especially avoiding getting together indoors, which we know is difficult in the winter to avoid, but that really is the largest method of transmission based on all the data from contact tracing, is those indoor social gatherings where folks are together without masks for an extended period of time, essentially sharing air, which we know the virus does aerosolize, and so that is how we're seeing it largely spread. So until we can get the federal government to up the vaccine allocations to the state and to our county, this is the most effective tool that we have. We saw it work in the first wave, so please continue to follow these guidelines and don't let our guard down. As tired and maybe even exhausted as we may feel with these restrictions, we have to just continue to hang on a little bit longer with these until we can ramp up vaccination. So now we'll talk a little bit about where we're at in Ulster County here. In New York State, I'm going to zoom out for a minute. In New York State, last week, New York State received 300,000 total doses of COVID-19 vaccine to vaccinate millions of people that are eligible. So that math obviously does not add up, leading to much frustration. And then this week, nothing other than just a fundamental failure at the federal level has resulted in a situation where we actually got even less in New York State this week than we got last week. So last week there were 300,000 doses for the state. This week, 250,000 doses for the entire state. What does that mean in Ulster County? Well, it means two things. Number one, it means more than anything, we need more vaccines. We need more vaccines. We need them now, and the only entity capable of upping this is the federal government. And so I want to be very clear that the responsibility lies there, and that that is where we need to push. That is where I'm pushing, and I know everyone on the ground, as well as the governor and our state leaders, are strongly urging the federal government to step up. We even saw Governor Cuomo, I think correctly, directly reach out to Pfizer, a New York-based company, and say, look, the federal government isn't getting us what we need. Can we work with you directly? And that's the kind of aggressive posture that we're taking here, that we all need to take to get creative, to get more vaccines out there. In Ulster County, what that has resulted in is last week we received 1,200 total doses in Ulster County, and this week it pains me to report that we're actually receiving less this week than we did last week, which would make sense given that the state got less. This week, Ulster County, across both our county site and some of our partner sites, will receive a total of 1,000 doses of COVID-19 vaccine that has been allocated to us. We're expecting to physically receive those doses sometime Wednesday, tomorrow, and then we will be reactivating our point of dispensing site, our pod site in Kingston on Thursday and possibly through Friday to make sure we distribute those 1,000 as quickly as possible. I do want to be clear and set expectations. As much as we want to get this and need to get this to everyone, that site is and will continue to be for the foreseeable future by appointment only. And right now for this week, the appointments for this week are already claimed because we actually had folks from last week who had signed up who were not able to get vaccinated. So we're carrying them over into this week and giving them priority this week. And then as we get more in the following weeks, we'll be opening that up again. Once again, the number of calls that I'm getting and we're getting at our office, our recovery service center, is a huge volume, and I understand the desire for folks to get vaccinated, and I appreciate that. I think the reality is that in Ulster County we've got somewhere between 60 to 70,000 people that are eligible right now under the criteria, and we've only, as you see, have a very, very small amount of doses to meet that need. So until we get this supply up, it is going to be frustrating, and all that I can do and will continue to do is be forthcoming with that, be transparent with that, and let you know where we're at, as well as, believe me, fighting and pushing and advocating as much as I can to make sure we are getting our fair share here in the county of what the state is getting, of making sure that what we do have is being distributed quickly and safely and equitably. Of the doses we're getting this week, because of how efficient our pod site is, we believe we will get all of those out to residents within that first day of running the site. And we can even do more. We can do up to 1,500 doses a day at our primary point of dispensing site. And I am very anxious for the day when the supply will finally arrive and allow us to get that up and running at full speed, to get our second pod site up in Ellenville, to get our other partners supplied so that we can get this vaccine out to those that want it and do it as quickly and safely and equitably as possible. For everyone out there that is wanting more information and wanting to be ready for that moment when we do get more supply, we set up a vaccination resource center, county specific. It's a great place. You may not get the answer you want, which is that we all want the vaccine, but at least you will get the answers of where we're at and the accurate information of what we have right now and what's coming. So going to vaccinateulster.com is a great first step. It's, again, there's a lot of information at the federal level and the state level, but this is customized to us here in Ulster County to really be a local resource for you and folks you know. On that site, you can get answers to frequently asked questions. You can check your eligibility to see if you're in phase 1A and 1B, which is where we're at right now. And most importantly, you can sign up on our list to get more information, as well as to be notified personally and directly once we do have appointments that are opened up. So we've had over 20,000 people sign up on that list, and that list means you'll be getting regular updates of what the county is getting in terms of doses, and ultimately, if you're on that list, once we do have appointments that open up, that's where that link will go out to, and that'll put you in a good spot to get signed up as quickly as possible. And again, I just ask everyone's patience here as we navigate through this. Across the state and the country, there is just a severe shortage of the vaccine, and it is maddening, but it is also, I think, important to remember that it's been less than a year since we had our first COVID cases, and the fact that we have any vaccine available right now anywhere is quite remarkable from a scientific and a research perspective. And so now we're pushing those companies, we're pushing the federal government to speed that production up. Finally, I know many of the calls and concerns that we're getting are from seniors and others that are having challenges from a technology perspective or having questions and concerns. We did stand up an additional support line specifically for our seniors, especially given that anyone 65 and over is eligible now, and there are tens of thousands of our residents in that category. So for seniors specifically who need help with vaccine resources, who have questions, who are having trouble navigating our website or the state website, you can, and I encourage you to directly call our Ulster County Office for the Aging. The number there is 845-340-3456. That's an easy one to remember. Those are our updates in terms of what's happening with COVID infections and the vaccination process. The only other thing that I wanted to make everybody aware of, and I think I'm really glad that we are participating in this. So this evening, across the country at 5:30 p.m. Eastern, as part of the beginning of the inaugural process in Washington, D.C., there is actually going to be a national moment where at the Lincoln Memorial in Washington, D.C., but in towns and cities and villages and counties across the United States, all at the same time, there will be a nationwide tribute to remember and to honor all the lives lost to COVID-19 over the last nearly 1 year period here in the country. And I for one, I know we're still in the middle of this, but I think this is a really important opportunity for all of us to take that moment and wrestle with and think through the sheer volume of devastation and sickness and death and tragedy we've experienced, and to think about the individuals and their families, and just take a minute to recognize that and ultimately pay tribute to them. Many of these folks weren't even able, especially early on, to even have their loved ones with them as they passed. In the U.S., at least as of a few moments ago when I checked the statistics, there's been 399,053 Americans who have succumbed and died from COVID-19. Nearly 400,000, 399,000. In New York State, unfortunately leading the country, there have been 40,753 New York State residents who have passed. And as I said earlier, in Ulster County, 177 of our neighbors and friends have passed. And so tonight at 5:30 p.m. Eastern, our Ulster County office building will observe and be part of this national moment to pay tribute to those who have lost their lives. And we'll be lighting up our county office building with red, white, and blue, along with hopefully tens of thousands or hundreds of thousands of other places across the country. And again, to my comments at the beginning of the update, I hope we can all take that as a moment of solidarity and being in this together, and both paying tribute, but also hopefully keeping that perspective that we're not through it yet, but we are making our way through this. If we can continue to stick together and take care of each other, that we can come out the other side of this, and we will come out the other side of this. And so for anyone that wants to participate in that, those events will be streaming live. We'll be doing it on our county social media as well. With that in mind, I want to thank all of you for watching. I know this is sometimes hard to hear and heavy stuff, but I appreciate you always being engaged and tuning in. I want to thank all of our frontline workers still putting themselves and their families at great risk for all of us. Every time I go into the post office or go to the grocery store or see one of our first responders responding or see our teachers heading back into classrooms in many districts and our students, I am beyond appreciative and thankful for what you are doing to be part of the backbone of getting our community through this. So thank you on behalf of all the residents of the county. If you need anything, as always, you can call our Recovery Service Center. That number is 845-443-8888. There's also our website with lots of good information on it, including that Vaccine Resource Center, or you can reach out to us via email as well. So we will be doing our next update on Thursday. And in the meantime, if anything dramatically changes, and this is very much an ever-changing dynamic, especially with the vaccinations, we will let you know. In the meantime, do encourage you to sign up at VACCINATEUlster.com to get those live updates as they're coming. I want to thank also the Radio Kingston team and Diana Manuel for helping us keep you all updated. And we will see you in about 48 hours. In the meantime, stay safe and healthy and stay resilient, and we will talk to you soon.